So today we're going to talk about different savings programs. First, I want to talk about Medicaid. When someone is eligible for Medicaid, they're under 65, they're going to go through like the Maryland Health Connection or the Marketplace, whichever state you're in. However, when someone turns 65 and they're eligible for Medicare, you apply for Medicaid differently. And the income limits are different through Medicaid. Under 65 versus over 65. It's not necessarily a totally different program, but it is different. And you direct someone to what is called social services to apply for Medicaid. Now, each state normally also has an office that will assist with helping people apply for different savings programs through the state. It's called the SHIP office. So basically every county has a SHIP office, SHIP. And at these offices, there are people dedicated to help people apply for these services that will help them pay for their Medicare, help them pay for their co-pays, their deductibles and such. Now, the limits for people and for these programs are very, very low. So these are going to be for very, very low income individuals. So the other difference between under 65 Medicaid and over 65 Medicaid is that under 65 Medicaid today, it hasn't always been like this, but today they only look at income. Over 65 Medicaid, they look at your income and your assets. And so someone may have a lower income, but your assets also have to be very low, which is different than the under 65 Medicaid. So there are 4 different types of programs that someone can be eligible for. So the first program is called QMB, Qualified Medicare Beneficiary. So if a client is eligible for the QMB, or the government will help pay for the Part A and or the Part B premium. It also can help pay for the deductibles, the co-insurance and co-payments, and extended hospital stays and the skilled nursing facility co-payments as well. And so if someone this is like fully eligible, like QMB is fully eligible for like assistance, they wouldn't not need a Medicare supplement plan if they are a QMB client. So we would not help them with a Medicare supplement plan. They do not need it because their QMB is going to help them pay for all their deductibles and co-payments. If someone does qualify for QMB, then they automatically will qualify for what is called extra help, which is for the prescription drug plan. This will reduce the members' cost greatly for their premium. Typically, most plans participate with the full extra help and their premiums will be $0, or they'll pay very low, and their prescriptions will not be more than $3.70. And so if you do get a client that is a QMB, you can still help them with a prescription plan, but not with a Medicare supplement plan. So the next level of help is called Specified Low Income Medicare Beneficiary. And so this is also another income level that people are eligible for. So this is also called SLIMB. You'll hear these words, trust me, these clients will tell you. So SLMB will only pay for the Medicare Part B premium only. So it's not going to help pay for the deductibles, the co-payments. So someone might still want a Medicare supplement if they're eligible for the SLMB, because it will only pay for the Part B premium, which is a big help for a lot of people. Being eligible for the Specified Low Income Medicare Beneficiary also qualifies someone for the full extra help, which we talked about just a second ago. So full extra help. So extra help is a program through the government as well, and it's for the prescription plans. Again, the full extra help is going to pay for the prescription plan. Most prescription plans, some prescription plans, there'll still be a premium. But when you're filing on Medicare.gov, like someone's prescriptions, you're going to see on there it's going to ask you the question if the client has full extra help or partial extra help, or do you not know? So again, remember there's full extra help and something called partial extra help. So if they're eligible for full extra help, the Part D premium and the deductibles paid for, and they won't pay more than $3.70 for generics or $9.20 for brand name drugs. Partial extra help, someone can make a little bit higher income, not much higher, and still be eligible for like a sliding scale on their prescription plan. It'll reduce their premium, it'll reduce their deductible, and it will reduce their co-insurance cost to about 15%. So let's say someone's income is very, very low, which would be lower than QMB eligibility and SLMB, SLMB eligibility, and they're eligible for Medicaid. This is someone is eligible for Medicare and Medicaid. It's considered dual eligibility. And so Medicare will be the primary insurance always under this type of situation. And the Medicaid would normally begin after Medicare, but Medicaid would pay secondary. So in addition to what I just mentioned about the programs that are available through the government, each state typically also has a senior prescription drug assistance program. It's a subsidy that is state specific, so it's different from state to state, and also some states don't have this prescription drug assistance program. Thanks for joining in today and learning more about Medicare. If you'd like, click more of my videos and we can learn about Medicare together.